Try Cracked Feet.
Yeah, for all the talk about a vaccine that could be coming, it's still a ways away, and we might have a very long autumn and winter to get through first. Joining me now to talk more about where we stand here in Connecticut, I'm happy to have Keith Grant. He's an APRN and Senior System Director of Infection Prevention at Hartford Healthcare. Mr. Grant, thank you so much for joining us today. And I want to start by talking about COVID fatigue. You were just mentioning that a couple of minutes ago before we went on the air, that we've been dealing with this for so long and may have to for a number of months. You're worried that people's resolve might be beginning to falter a bit.
Yeah, absolutely. Thank you so much for having me. I think this is one of the things that I don't think we talk about enough. Appreciating the fact that, a lot of people feel like we've been here before. And to be honest with you, we definitely have. And as I spoke about before, October 10th, we had 48 patients within our system that are positive. Today, I have over 168 patients in Hartford Healthcare system, right? So those are huge numbers. So from a community perspective, you're seeing this within, your neighbors. From a healthcare perspective, we're seeing this in the hospital. We've seen these numbers up before, and we know how this look. And what I will implore to everyone is the fact that although we've gotten to this point before, we've gotten down to numbers wherein we're the best by far in the country. And we've only gotten to that number by maintaining our resilience, ensuring that we're doing proper hand hygiene, we're maintaining social distancing, we're wearing our PPE appropriately when we need to, and we're getting tested. So we're getting tested when we believe we are exposed. We're isolating ourselves when we believe we're exposed. We're getting tested if we have any form of symptoms. So if we keep on that road and appreciate. The vaccine is I don't want to say just around the corner. It's
right.
It's much quicker than we believe it would have would have been. And based on the reports yesterday, it's also supported by science.
Right.
So 90% efficacy. So if you look at a vaccine, 90% efficacy. Remember, the FDA said that they will support a vaccine that's over 50%.
Yep.
This is 90%. So this is significantly better than the minimum standard.
Yeah, like we've been saying, that's something that the flu shot could only dream of. We have limited time, Mr. Grant. I want to ask you about testing, because Hartford Healthcare started to try to ramp that up, especially with the Connecticut Convention Center. Are you able to get those test times, the time it takes to turn the test around, lower? Because I know it used to be close to 3 days, which made these PCR tests, as accurate as they were, still have a little bit of a limited utility with being able to get people results quickly. Where do we stand with that now?
So that's something we're working on, and not just we as in Hartford Healthcare, but the general medical community is appreciating how important the PCR is and that data is. There's multiple platforms the hospital and health system is looking into getting into the hospital and hopefully make available to the community. I think right now we're a little bit over 24, some realm about 38 hours for test results. We're hoping to get that down much sooner.
Okay. Well, Mr. Grant, thank you so much for your time. We do appreciate it. We want to talk to you again soon, especially as we get closer, hopefully, to that vaccine sometime next year. Glad to talk to you. Thank you so much. All right, 10:55. Oh, I'm sorry about that. Sorry, I didn't mean to cut you off. Thank you again. We are